Today we're going to talk about the benefits of peptide therapy for women and dive into the different types of peptides and what their benefits could be when it comes to women and hormone balance and metabolism. I'm Dr. Shelley Meyer. Thanks so much for joining me on my channel. I'm a functional medicine doctor, registered dietitian, and family doctor. And you may be familiar with peptides already. And if you haven't done so yet, please like, subscribe, and share this channel if you like what you see here. That really helps the channel grow. A lot of videos on hormone health and gut health and metabolism and all kinds of things. So, for women who are navigating perimenopause and menopause, which I've been talking about a lot lately, peptides can make a difference in different ways. You're probably familiar with peptides, and maybe you don't know that you're familiar with peptides because most people have heard of glucagon-like peptide 1 medications, and those are semaglutide and tirzepatide. Those are some of the most popular ones. There are other brands or other formulations, and those are the generics of Ozempic and Wegovy, and what the other most people know them as Ozempic and Wegovy. Each company has two different kinds, one for strictly for weight loss and one for diabetes, but they're actually the same medications. So now we have those brand names from the big major pharmaceutical companies. We also have compounded versions of these that a lot of companies have branched out into making and providing at a more affordable, sustainable for the patient, and flexible dosing, I guess you would say, level. But those are peptides. So those are glucagon-like peptides, and they help with weight loss and metabolism and blood sugar, as we know. We also find that sometimes they help with brain fog. They help with post-COVID symptoms sometimes. I mean, these are off-label uses. I'm not advocating that everybody use them for this because you really have to work with your provider and look at the research and know that it's right for you. But we have seen them help heart, like cholesterol levels and reduce plaque, and of course, lower weight, but lower blood sugar and insulin resistance and all that. So a lot of benefits. There can be some side effects, which I'm going to go into too, but I'm not just focusing on those peptides that everybody's familiar with. We're going to backtrack and talk about what peptides are, what are some of the new ones that are coming out and have been out and people aren't as familiar with, and what can be some of the benefits and the side effects of them. So peptides are short chain amino acids that serve as building blocks for protein in our body. Sounds good, right? Sounds natural, right? And definitely can be, but they do manipulate our hormones and our different growth factor growth factor hormone type issues in our body. There's different ways that each of them work, and they're not all the same, so it's hard to like sum it all up into that one sentence. So that's why I was struggling. But they're not completely benign, even though they are natural short chain. I mean, the peptides themselves are actually short chains of amino acids, which sounds really benign. So they're powerful molecules. They can play a crucial role in various functions. And if you see me reading, I'm reading from my blog, which is perimenopause.help. I go over lots of different perimenopause support and phases and symptoms and menopause support as well on that blog. So check that out if you're interested. And they help anything from metabolism to healing to skin repair, tissue repair, gut health. I've used different peptides for, so really interesting. And they're like mini proteins, like I said, and they have really big jobs. Unlike larger proteins, these dialed down peptides can easily penetrate the skin, they can penetrate the bloodstream, and they can be therapeutic for different aspects of systems in our body that we may want help with. So let's dive back into the history of peptides, though. You may be interested to know that the peptide story began back in the 20s when the insulin first came out, because it was the first peptide that was synthesized in a lab. So natural, origin story as far as what peptides are, but they are synthesized. They're all made. And insulin would be the first one. So since 1923, insulin has been, helping people with diabetes. It's been perfected in different ways and made be longer acting, shorter acting, different ways of injection as far as syringe versus the click pens. But insulin is a peptide, and that was the first one that we started using. If you hear heavy breathing. That's my dog over here on the bed next to me. So he's old. I didn't want to make him move for when I was recording. So for women navigating this whole new world of perimenopause and menopause, we may be looking for solutions, and peptides could be an option. So some of them can offer, like I said, the GLPs can offer improved metabolism and weight management, but they're not perfect and they're not for everyone. You can also get better muscle tone and strength with certain peptides, better sleep quality, improved energy levels, and improved skin elasticity and texture. My last video was all about menopause skincare changes and menopause skincare routines that can help those changes. So peptides can be another thing that can help. So what are some popular peptides? Well, like I said, definitely semaglutide, significant fat reduction. Everybody knows about it pretty much. So that can be helpful. That can be helpful in more ways than just blood sugar control and weight loss. Like I said, it can help sometimes your brain function, can help your insulin resistance levels. Even if you're pre-diabetic, it could help that. It could help your cardiovascular status as far as your cholesterol and triglycerides go too, and your inflammatory markers, so make you less inflamed. It can also cause constipation, headaches, fatigue, lots of fatigue. So, and mess with your pancreas if your pancreas is sensitive. So you should not go on these if you're a super heavy drinker that has bouts of pancreatitis. Do not do that. Or if you have a very, very, very rare condition in your family or in you called medullary thyroid carcinoma. Not regular thyroid cancer, that's much more common. That is not the same thing. So this is a very rare type of cancer, and any doctor or provider that's going to start you on GLPs will always screen you for this. The other popular one is tirzepatide. That is brand name Mounjaro or Wegovy, I think, yes. And it is, well, actually, Wegovy is the same as Ozempic. Sometimes I forget their brand names because I'm using the compounded a lot more often. And so tirzepatide has multiple different hormone actions, and when it first came out, they found it was a lot more effective than semaglutide for weight loss. I don't find that's always the case. I will use one or the other with my patients sometimes if it's appropriate for them and we feel like it's safe for them. But it definitely does help with all the same things that semaglutide does, and it also helps to a little bit more with some of the body composition stuff sometimes. So peptides can work through a lot of different metabolic pathways. They can enhance insulin sensitivity, like we said, and specific peptides which we're going to talk about here soon, can help promote collagen production. And let's see what else. We talked about weight management, energy production, and they can help your body process fat, so break down those stubborn areas of fat. And then let's talk about hormone regulation. So during perimenopause, menopause, obviously, like I've talked about so much on the channel, estrogen's dropping gradually, progesterone's taking a dive even from the beginning, and certain peptides can help kind of balance that out. And help even some of the symptoms of not hot flashes, mood swings, sleep disturbances. Peptides can be delivered through various methods. The ones I already talked about that you're most familiar with, before I said Wegovy, that is not Mounjaro. I mean, that is not tirzepatide. Like I said before, that's the same as Ozempic. And then the tirzepatide is different, but either one of those are injectable. So they're usually once a week. So a lot of peptides you can find have an injectable version. There's transdermal creams for other types of peptides, so creams you put on the skin. There's oral tablets like BPC 157 I use for sometimes for gut health, often for joint repair and like injuries with athletes. But there's also some benefits to BPC 157 for weight loss. It works through the growth hormone pathway. And then nasal sprays for specific peptides. What else? I talked about some of the side effects of peptides. And let me just go to my other part of the article. Make sure I didn't miss anything. Oh, another one that works through growth hormone. Now I'm going to get into some of the specifics of different peptides that you may not have heard of. Is AOD 9604. It's a fragment of growth hormone. Stimulates breakdown of fat, but doesn't affect the blood sugar. So that may be helpful for people like me who have lower blood sugar and wouldn't be able to. I don't think I'd want to take the semaglutide. I think it'd make me too tired, or tirzepatide. Doesn't do that to everybody, just the way I am sensitive, it would. And I don't feel like I want to lose that much weight, just a few pounds. So this one doesn't affect blood sugar, AOD 9604. I did try something similar. I think I tried this one several years ago when peptides were first coming out, and it was very stimulating, like made me really anxious. I, again, am not your standard person. I am very sensitive to supplementation, to medication. So if I say it bothered me, doesn't mean it's going to bother you. And you'd have to talk with your doctor to see if it's safe, your provider. But that can help with the weight gain that can happen with perimenopause and menopause. Let's talk a little bit about another growth hormone modifier, CJC 1295 and ipamorelin. Sometimes these peptides, the names I have trouble with. So that can help with growth hormone and metabolism and muscle, like I was talking about before. So maintaining muscle mass, which we do lose muscle mass in perimenopause and menopause. So something to think about. Aids in sleep recovery and hormone balance, can support collagen production for healthier skin and joints. So I have seen some positive responses related to these when I've used that with women in perimenopause and menopause. Kisspeptin 10, that is another growth hormone regulator, may support ovarian function, estrogen balance during perimenopause, and can help regulate reproductive hormones. Thymosin alpha-1, that is helpful for immune function, and that can sometimes falter in perimenopause and menopause. Regulate inflammation, and that can help metabolic dysfunction through the inflammation pathway. BPC 157, I already touched on a little bit, but that promotes healing and reduces gut inflammation. It can help you absorb your nutrients better if you're inflamed in your gut, and can help with my digestive issues. But really, it's been promoted a lot for the healing with after injury, like a muscle, ligament, that type of injury. So I've seen it work in both areas, the gut and the muscle. And then I've also seen it help some with weight loss, mainly when I've seen it I've used it in combination with Akkermansia, which is a probiotic strain that helps to, it's not a peptide, but it helps to promote GLP-1 production. So it helps to promote peptide production that's natural in our bodies. So there's a brand that I have it downstairs, but it is from Infinawell, and it has BPC 157 and Akkermansia in there. So that's on Fullscript, my supplement dispensary. But always discuss it with your doctor. Make sure your blood sugar could handle it, that you're, looking at any kind of potential like side effects that you may have. Always don't start anything just because you hear about it online. I'm just kind of going over what's out there. So these are some of the more popular ones. There's lots of other peptides. I'm not as familiar with the other ones because it is an evolving field, and it would be nice to have some more years under our belt of trying these and making sure people tolerated them well. But those are just some of the things that peptides can help with. I think I went over, how you use them. Make sure I don't miss anything. So if you're looking for insulin sensitivity, like I said, the semaglutides and tirzepatides in that GLP class can help. If you're looking for growth hormone production, that CJC 1295 and ipamorelin can help for lean muscle mass. Appetite and cravings, I hear a lot about the GLP-1s helping with that from my patients, reducing the food noise, they call it, where you just think about food a lot. So again, you probably know people on these already. You may have tried them yourself. Everybody has different opinions on them. And then thymosin alpha-1 and the BPC 157 if you're looking to lower inflammation. And a lot of these peptides, because of their growth hormone and hormone support, can help the skin elasticity and collagen as well. So I'm going to dive more into these in more different kinds as I use them more often in my practice. I just wanted to introduce some of the ones that I've used with women and men as well, and those that can help, particularly in perimenopause and menopause. But again, it's an evolving field, relatively new field. Like insulin's been around for a very long time. The GLP-1s have been around for like 20 plus years, so that's like the semaglutides in that family. But these other ones may have been around a long time, but we haven't used them as much for as long of a period of time. And they're not as studied because they're not made by major pharmaceutical companies, which, that's a whole nother topic. But I wish there was more studies with these smaller things that weren't made by larger pharmaceutical companies. So there's just not as much information about them, but it is something you could think about. It's kind of the medicine of the future, and we'll see where it goes. But I just wanted to introduce these to you. Let me know if you've tried any of these, if you've worked with a provider using any of these, what your response has been, and let's all get a conversation going in the comments. So thanks so much for being here, and I'll see you in the next video. Don't forget to like, subscribe, and share if you like this channel and the content I have here. It really helps the channel grow, and I'll see you next time.